Now we'll discuss about the sole of the foot part 2. In this section, we'll discuss about the muscles of the sole. First of all, we'll discuss about the muscles present in first layer. Here, this is calcaneum. Here is medial tubercle of the calcaneum. Here is lateral tubercle of the calcaneum. Here is cuboid. Here is lateral cuneiform, intermediate cuneiform, medial cuneiform. This bone is navicular bone. And here is spring ligament is present. This is spring ligament. Here is first, second, third, fourth, fifth metatarsals, proximal and distal phalanx of great toe, proximal, middle and distal phalanx of each toe. So first of all, discuss about the muscle of the first layer. There are three muscles present in the first layer. Here is medial tubercle of the calcaneum. This is medial tubercle of the calcaneum. Here is position of medial intermuscular septum, and here is position of flexor retinaculum. Here is position of plantaris. This is plantar aponeurosis. This is position of plantar aponeurosis. And muscle takes origin from medial tubercle and adjoining part of medial intermuscular septum. Here is flexor retinaculum and plantar aponeurosis. From here, the muscle takes origin, that is abductor hallucis. This muscle is abductor hallucis. And another muscle which takes origin from lateral part of the sole, that is takes origin from lateral calcaneal tubercle, also some part from medial calcaneal tubercle. Here is plantar aponeurosis, and here is position of lateral intermuscular septum. So it takes origin from all these points and inserted on here. This is base of proximal phalanx of little toe. Here is base of proximal phalanx of big toe. So this muscle is abductor hallucis. This muscle is abductor digiti minimi. So this muscle is abductor at first metatarsophalangeal joint. This muscle is abductor at the metatarsophalangeal joint of little toe. Here is abductor at metatarsophalangeal joint of big toe. Now another muscle which takes origin from this plantar aponeurosis, medial tubercle, medial intermuscular septum, lateral intermuscular septum, and this muscle is This muscle is flexor digitorum brevis. So it takes origin from here. This muscle is flexor digitorum brevis. Flexor digitorum brevis. So it has 4 tendons for 4 lateral toes. So these are 4 tendons. These tendons at the level of proximal interphalangeal joint. This is proximal interphalangeal joint of second, third, 4th and 5th toes. Here it divides into medial and lateral slip like this. It divides into medial and lateral slips. Medial and lateral slips. And it is like this. It is divided into medial and lateral slips. Between these 2 slips, tendon of flexor digitorum longus passes. Between these 2 slips, here is flexor digitorum longus tendon passes and which is inserted on the terminal phalanx, base of the terminal phalanx. So this flexor digitorum brevis is inserted on either side of the, both side, medial and lateral side of the middle phalanx of second, third, 4th and 5th toes. So action is flexion at proximal interphalangeal joint and also metatarsophalangeal joint of the second, third, 4th, 5th toes. So this is all about the first layer of the sole. Now we discuss about the second layer of the sole. In second layer, there are 2 extensive muscles comes from the posterior compartment of the leg. These muscles are, here is one muscle, tendon, that is flexor hallucis longus. This is flexor hallucis longus, this tendon is, which is inserted on distal phalanx of the big toe. And then is flexor digitorum longus, which has 4 tendons, which is inserted on base of terminal phalanx of second, third, 4th and 5th toes. So these are four tendons of flexor digitorum longus. This is flexor digitorum longus. So these are 2 extensive muscles arise from posterior compartment of the leg. Now the muscle of the sole, that is 2 intrinsic muscle of the sole in the second layer. These are this muscle is flexor digitorum accessorius. This muscle is flexor digitorum accessorius, which takes origin from medial and lateral tubercle of the calcaneum and inserted on the flexor digitorum longus here, and its action is, it strengthens this action of this flexor digitorum longus, that is flexion at distal and proximal interphalangeal joint. So this is flexor digitorum accessorius. another muscle of second layer which takes origin from the medial side of tendon of flexor digitorum longus. So here flexor digitorum longus tendons towards the medial side give a muscle. This muscle is lumbrical. So this is first lumbrical which takes origin from medial side of tendon of flexor, first tendon of the flexor digitorum longus. This is first lumbrical. This muscle is unipennate muscle. And second lumbrical takes origin from two adjacent tendons, that is first and second tendon, and it passes like this. And same way, this is third lumbrical, this is fourth lumbrical. So in this diagram, you can see the first lumbrical is unipennate, second, third, fourth are bipennate. And these lumbrical muscles inserted on, after crossing this metatarsophalangeal joint, it is inserted on dorsal digital expansion. So this is, here is, in this diagram you can see this is dorsal aspect of the metatarsal, proximal, middle and distal phalanx, and here is extensor digitorum longus which divides into center slip and two collateral slips. Collateral slips are inserted on dorsal surface of the distal phalanx. Here is center slip which is attached with the middle phalanx, and here is a dorsal digital expansion. This is dorsal digital expansion. So if you see this, so this is attached with here, lumbrical attached here. So it crosses the joint like this from inner aspect to, from sole or plantar aspect to dorsal aspect. So this lumbrical acts at the metatarsophalangeal joint and also interphalangeal joint. In the metatarsophalangeal joint, it causes flexion. At interphalangeal joint, it causes extension. So in second layer, there are two intrinsic muscles. These are flexor digitorum accessorius and lumbricals. These are four lumbrical, first, second, third and fourth. Now we will discuss about the third layer. Here, before going to detail of the third layer, we will discuss about the insertion of the some muscles. Here is insertion of tibialis posterior muscle. This is insertion of tibialis posterior muscle. It is inserted on tuberosity of navicular bone. This is navicular bone. It is tuberosity. It is attached on the tuberosity of navicular bone, and it gives numerous slips to all the tarsal bone except talus, and it also gives slip to metatarsal bone, second, third and fourth metatarsal bone. And here is a long tendon of peroneus longus. This is tendon of peroneus longus. This tendon passes through a osseofibrous tunnel like this. So after this, we will discuss about the muscles of this region. Here is one muscle which takes origin from the margin of this osseofibrous tunnel. It takes origin from cuboid, cuneiform, lateral cuneiform like this. This is lateral head of flexor hallucis brevis. This is lateral head of the flexor hallucis brevis, and here is another head, that is medial head, which arises from medial cuneiform and also from the slips of the tibialis posterior here. So these two heads join with each other like this. It is Y shaped like this. This muscle is flexor hallucis brevis muscle. And this muscle, after joining these two heads, divides into two slips. It gives two tendons. One is attached to medial side and there is attached to lateral side of the proximal phalanx of the big toe. This is flexor hallucis brevis. Another muscle which takes origin from here. This is fifth metatarsal and adjoining part is cuboid. So from here it takes origin and inserted on the base of the proximal phalanx of the little toe. This is flexor digiti minimi brevis. This is flexor digiti minimi brevis. Another muscle of this region, that is adductor hallucis. So adductor hallucis takes origin from second, third and fourth metatarsal near its base. It is inserted on lateral side of the base of the proximal phalanx of big toe. This is adductor hallucis. Adductor hallucis. This is oblique head. Adductor hallucis. This is oblique head. Another head is transverse head. Transverse head takes origin from, here is deep transverse metatarsal. Here is deep transverse metatarsal ligament. And at this junction, at this joint, metatarsophalangeal joint, on plantar surface, there is plantar ligament. So transverse head takes origin from these points, deep transverse metatarsal ligament and plantar ligament. So this head is transverse head. So adductor hallucis has two heads, oblique head and transverse head. Action is adduction and action of these two muscles are flexor of the corresponding toes. So this is all about the third layer. Now we'll discuss about the fourth layer. The fourth layer, here you can see, in fourth layer there are three plantar interossei and four dorsal interossei. Plantar interossei takes origin from medial side of third, fourth and fifth metatarsal. Third, fourth, fifth metatarsal. These are plantar interossei. These are three in number. This is first, this is second, this is third. And these muscles crosses the metatarsophalangeal joint and after casting this joint, it is inserted on dorsal digital expansion here, and also it is inserted on base of the proximal phalanx. Action of this is adduction. So plantar interossei action is adduction. Here is central axis, so its adduction is towards the second toe. And there is another muscle which is a dorsal interossei. So there are 4 dorsal interossei. There is first takes origin from lateral side of the first metatarsal and medial side of second metatarsal. This muscle is bipinnate and it crosses the joint and inserted on the base of the proximal phalanx. So this is first, and another is second. It takes origin from adjacent side and inserted on the proximal phalanx of the second toe. So both first and second dorsal interossei are inserted on medial and lateral side of the proximal phalanx of the second toe. Here is third dorsal interossei, which is attached with the lateral side of the, so it takes insertion with the lateral side of the base of proximal phalanx of the third toe. Here is fourth dorsal interossei. It is inserted on the base of the proximal phalanx of the fourth toe. So action of these muscles, dorsal interossei, are abduction. So these are the all muscles of the all 4 layers. First layer, second layer, third layer, and fourth layer of the sword. Thank you.